Dr. Sudak, your tips about adherence, medication adherence are very important. And I want to ask, sometimes we are in an even more difficult situation, not
Sure.
just forgetting to take the medicine or like feeling it's not necessary or wishing it was not necessary. But we may have a situation where the person is in fact having a significant side effect.
Right.
So, for example, weight gain and sexual dysfunction
Right.
are two common things that occur. They are
Absolutely.
pretty hard to manage. And logically, the person is not wrong in saying they want to get off the medication.
Right. So, and I think that those come in a bucket that I call thoughts that are true but not very useful. And the way I think about it is this. One is that I will go to the ends of the internet and PubMed to try and find every possible way of combating a side effect. I think that patients will persist if I do. I talk about how we can try in a stepwise way other ways of managing this and see whether or not we can be effective so that they can find a way to manage their illness that is acceptable to them. And I think one of the things about this is trying to be what I call on the same side of the table, that both of us are working for them. And I'm not just trying to have them, you accept it and you just have to live with this weight gain. So I also happen to be a person who profoundly believes in science. And so one of the things that I'll often say to patients is, this may be the best we can do for now, but I've certainly practiced in psychiatry long enough that I actually know that many other drugs became available in my lifetime, and I
Right.
expect more, and that we might find some other ways to manage this.
Give them hope.
Right, exactly. So there's that piece. But I think it's really persisting and trying to find an acceptable set of alternatives, even if it means the cumbersome task of trying a different medicine or trying to add something, or finding the right balance that's acceptable. If the tremor is really not that acceptable, maybe the person is going to have to take a little more risk about the possibility of having an episode because they want to be a concert violinist. I mean, I think that this is a collaborative decision.
I like the term being on the same side of the table, and the patient should feel that.
Exactly.
What about if the patient then takes over time takes a decision that they want to get off the medication?
Right.
That makes the people who prescribe medication very uncomfortable.
Right.
How would a person who has a CBT orientation deal with a situation like that, where the person's making a decision which you don't think is rational?
So a couple of things. One is that we often will do decision matrices, where we look at the advantages and disadvantages of staying on the medicine, the advantages and the disadvantages of coming off the medicine, and help the person to really examine whether it's real evidence, right? If they still make that decision, obviously, people have choices about this, and I tend to believe in informed consent. I tell them, here's what I think is the risks, and here's what I think are the benefits, and as much as possible, really try to set up early warning systems so that if things are starting to become problems, how are we going to set up a way to know that and intervene? I try to help people to do as many behavioral things as possible to stay well. I think it's more problematic sometimes when people won't ever start medicine, right?
Yeah.
That in some ways, because then they haven't have the chance to see that the medicine benefits them, and they can say, okay, I'd rather feel that way and still take the medicine. And then that circumstance, I think, besides looking at the meaning of medication, sometimes it's really helpful to try to find a hook. What about taking the medicine would benefit something the patient wants? It's not so easy sometimes to do that, and I think the real issue is then being able to keep the conversation going. Maybe enlisting the patient's family members if that would be helpful.
So it's a process over time.
Exactly.